they focus on not just the physical aspects of health and safety, but also the mental health aspects. And they, they kind of had a very holistic, very integrated approach, starting from basic general services of food, nutrition, catering, accommodation, housekeeping, laundry, maintenance, to information and community services, event coordination, sports and recreation, and delivery of psychological support. Now, the interesting bit over here is that they created a welfare team that was headed by a village mayor. And so that's how they designed the program. And it initially included professionals, but then later was supported by resident volunteers. And within the program, they kind of established a counseling and consultation service, a 24/7 mobile helpline, a village uncles and aunties program with resident worker volunteers as a first line of support. And I think that really worked well because they were able to train the village uncles and aunties, as they referred to them, to identify, relate and manage difficult and sensitive issues, so that they were able to intercept those issues before it kind of escalated. And over a 2-year period, they dealt with, I think, over 1,600 cases, or 1,600 touch points, as they referred to it. And within that over 1,600 cases, they were able to avert 320 risk cases, 25 non-fatal self-harm cases, and there was one suicide that was recorded over the 4-year project, which I think is really great, because again, it goes back to saying, and you involve the people and you bring in the community as such, or your employees together, you have, the scope for creating and making a difference is almost, it is higher at that point in time, right? As opposed to the management deciding, okay, this is what needs to be done. You kind of trained people from your community within the organization to kind of respond as peers to help and respond to challenges that people were facing. So I think that was a very good case example that I see in terms of a preventive and promotion, because over there they were educating, they were creating those touch points to prevent something from escalation, from averting a risk situation, in a way speaking.